Hi, welcome back to Then and Now with Connie and Vikki. And today we're going to do some pretty serious topics, I think.
Yes.
You've become engaged with researching Social Security, Medicare, and so let's find out what you learned.
So there are several major issues affecting seniors in the United States today. Some have been in the news recently, while others are long-term trends that continue to have a significant impact. And this is one of the things is because we're on our path. We both kind of have a goal of hopefully to retire within the 3 years. So a lot
Yep.
of this is affecting us, even though we draw Social Security. We
Yeah.
still have jobs.
I mean, this is personal, and this goes back to that time we were talking about being politically involved and stuff like that. And um, historically, you probably haven't been quite as involved as I have,
Right.
like with protesting and stuff like that. And we mentioned that if it was ever something that affected us personally, boy, you're right out there because you brought this
Oh,
up to
Social
my attention.
Security is
Yeah,
just
yeah,
is so important.
right.
Anyway, it's just one of the biggest concerns is the long-term funding that's in the news right now about Social Security. Congress is debating how to keep Social Security financially stable. Its current projections show that if no changes are made, benefits could be reduced in early 2030s. Although the program would continue paying benefits, several how do you ever pronounce it, whatever proposals have recently been introduced to address these issues.
And can I just add that Social Security, since it was signed into effect like in 1935, part of the New Deal with FDR, that it's been amended hundreds of times,
Right,
right? And this issue has come up many, many times too.
right.
What is bringing it so much to the forefront right now is because it's so quick. You know, we're talking 4 5 years 6 years, something like that, and it's within the next time frame of the next president.
Exactly.
So that's why all
But
of a
but it
sudden,
right.
yeah.
But it's also something that affects. It doesn't matter if you're Republican, Democrat, or Independent.
Oh,
It's going to affect all of us. And part of that reason is because baby boomers like us,
mhm,
there's so many of
right.
us that we're a. I hate to say this, it's putting a heavier burden
There
on
are more
social on
benefits being paid than there is money coming in.
exactly.
Yep.
And it says, so will Social Security be there for future retirees? The short term answer is yes, but likely with
Yep.
changes. Social Security is not expected to disappear. The bigger question is how much future retirees receive if Congress does not act.
Yep.
And there's a current outlook. Today's retirees and people already receiving benefits are expected to continue receiving them. That's a plus. I would be lost.
Absolutely.
But future retirees are also expected to receive benefits because Social Security is funded primarily through payroll taxes paid by current workers.
Mm-hmm.
The challenge is that people are living longer, birth rates have declined,
Mm-hmm.
and there are fewer workers supporting each other's retiree than in previous generations. That goes back to what we were just saying. So
Mm-hmm.
not only do we have all the baby boomers like
Yep.
us who are now drawing
Yep.
that Social Security,
Yep.
there's not as many kids out there or as
Right.
many people
Paying into it.
paying into
That's
it.
right.
So that's really a
That's right.
scary situation
Yes,
for
I
Social
also read
Security.
that part of that lack of paying in is the decrease in immigration, which I know is a big topic with everybody, but
Right.
immigrants pay taxes. And so that decrease is affecting what's going into the pot as well.
That's true.
Yeah.
So according to the latest projections from the Social Security trustee, if no changes are made, the trust fund used to supplement retirement benefits are projected to become depleted in the mid 2030s. Even then, Social Security would not go bankrupt. Ongoing payroll taxes would still provide enough revenue to pay roughly 75 to 80% of scheduled
Yeah.
schedule benefits.
Yeah.
But you know what? You take 70, if you're only going to get 75 to 80% of what I'm drawing now. I mean, I'm very blessed because I had a good job for a
Uh-huh.
lot of years and
Yep.
pay, and but I paid in a lot of money, and I do have a nice little
Mm-hmm.
Social Security check
Mm-hmm.
that with working helps me really increases my way of life,
Right. Yeah, for
and
sure.
that's
Yeah.
important.
Yeah, no, no. If you're talking a 20 to 25% reduction in what you get per month, that's going to affect a lot of people.
Right, and I
Yeah,
supplement mine because I work. But
right,
in 2030, if I were when we do, when I retire
right,
and or I something happens that
right.
I'm unable
Yep,
to do a little part-time job or
yep.
do something, that's really gonna that would major.
Significant impact
Yeah.
on your, yeah, quality of life for sure.
And this is, what does it mean for the different generations? People already retired or close to retirement, the expectation is that benefits will continue largely as promised, although future policy changes are always possible. Workers in their 30s, 40s, and 50s, they should plan on Social Security being part of their retirement income, but not their only source.
Which gets back to education as far as, somebody should be teaching this,
Right.
right? Somebody should be helping these younger generations plan for this.
You probably did. You're better than I'm sure you thought probably at that age, well, I got to think about retirement, or I need
Well,
my
I,
fund, or
I did when I was working because, a long period of my time, probably most of my 30s, I was a stay at home mom and then went back to work in my 40s, 42, I think. And then, yeah, it hit me. Number one, I think mainly because of the company I was working for offered, a great 401k, great matching. And so it's something, that's just there. And yeah, you realize that you have to make that investment. So you do become aware of also having something besides Social Security. But I mean, the majority of people kind of need to be taught that.
they do. I was never taught
Yeah,
that.
yeah,
I never thought, and I even tell my kids now when we talk about stuff that you've got to think about the future, because you don't know how important that is and how fast time goes by.
right,
And my kids are getting into turning into
right.
to 50,
Mm-hmm.
and so 12, 15 years may seem like a long time when you're
And it's not.
when you're in
Yeah,
your late 40s
yeah.
or early 50s.
Mm-hmm.
But let me tell you, at the bat of an eye,
That's right.
it's gone, and if you
It's
don't start doing something now,
yeah,
it's really scary.
yeah.
And it says younger workers just entering the workforce should also expect Social Security to exist through the program, although the program may look different
Mm-hmm.
by the time they require. And the bottom line is, most experts do not believe Social Security will disappear. The more likely outcome is that Congress to make changes
Mm-hmm.
before across the board benefit reductions occur. The exact changes and who they affect will depend on, like you said, future legislation. And just as if you're wondering about your own retirement, it says you can also estimate how much of your income Social Security might replace and discuss strategies to maintain
Yeah,
maximizing your
which is
benefits.
very important.
Yeah.
Yeah, absolutely. Um, yeah, it's going to take changes, and that's why payroll taxes. We go through this. I guess almost every year, the limit that you pay in for the wage limit goes up. Seems like
Right.
every year. So I mean, like I say, this is nothing new, but it is something that has to be addressed. And can you imagine? Because you said, it's gonna we expect it to exist. It's gonna look different, but we expect it to exist. Can you imagine? I mean, just the uprising that
Mhm.
if they tried to take it away or
I would
whatever.
be, yeah. I've paid all these years.
That's the thing. Yeah.
I've paid my dues.
Right.
You're not really giving me a gift.
Right.
You're
Right.
giving me
Yeah.
my
Yeah.
my money back.
Yeah. Since we had that first job.
Right.
Yeah.
So,
Exactly.
but this is what Congress could do. I mean, lawmakers, of course, they have several options,
Mm-hmm.
including increasing the Social Security
Yep.
payroll tax,
Yep.
raising or eliminating the cap on wages subject to
Yep.
Social
Which we just
Security
talked
taxes,
about.
right?
Yep.
Gradually increasing the full retirement age for younger workers, which they already do.
Yeah.
I know we were used to be 62,
Yeah.
and I think mine was 63 and a half or six, something
Really.
like that, or
Mine was
62 and a
66,
half.
66
Is it
in
maybe
6 months.
okay? Yeah.
66
So I
years
know
and
that.
six
Okay, then
months.
mine
Yeah.
had to be
Yeah.
like 5 months then,
Yeah.
or whatever it was, because they were
Right.
like the age a
Yeah.
year didn't make that much
Right. No.
difference. But I remember when I was getting I remember when I first even thought about drawing my Social Security was during COVID,
Really.
and they were going back in, and they were making cuts at work. They were making payroll where they needed us to, take a 20% payroll cut and everything. And I decided, well, you know what, I might be better off
Yeah.
if I went ahead and drew my Social Security and
Mhm.
did something, something a
Mhm.
little different.
Yeah.
And I did. I looked into that, and that's when we decided that you're that for on my aspect, it was actually a little better to go ahead and wait until my retirement. If I wait
Mhm.
till the minimum retirement age, which I think
The,
was 62 or
yeah.
whatever, or Greg, you said
Uh-huh.
65, whatever it was, and to go ahead and start taking that, because you had mentioned that you were going to wait. If you wait until you're 70,
Mhm.
you're going to get more money. Well,
Uh-huh.
but then now they're saying go ahead and take it younger, because you're going to end up ahead,
Yep.
because you're going to draw all this money before
Right.
you turn that way. And if you
Right.
take that money and you invest that money,
Right.
your outcome is in the long run is really going to be,
That's exactly right.
you're really not gaining
Let's
a
talk
lot.
about that just for a second, because I always forget how old I am. So,
Right.
I never paid really much
Right.
attention to, when am I going to take Social Security or whatever, because I was working and everything like that. And I was still under the impression that, no, I'm not going to take Social Security because I'm working. I plan to keep working, into my 70s. And then you and I got together and you were talking about it, and really brought it up. And my first thing to understand is like, no, if you wait till your full retirement age, then you can make as much money as you want
Well,
and still get your
you-
Social Security.
Well, actually, you do, but you don't, because when you pay your taxes and you
Oh, well, I
make
take tax out of my Social
right,
Security.
and when you make, but when you make more
Yeah.
on your Social Security, they do take out on I'm talking about your income tax.
Yeah.
You do have to pay so much.
Oh, yeah.
So but
Yeah.
it's
But you're right. But then when I came back and I did my little spreadsheet,
right.
like at full retirement, and I take this and I get this and I span that out over, okay, well, I'm gonna work for another 7 years at least. Yeah, it was there in black and white.
Right.
Yeah.
And for me, it really, it's kind of, people are struggling. And if I didn't have it, I would totally struggle, because it does kind of pay for I'm very fortunate, have a nice lifestyle,
Mhm.
thanks to Social Security.
Yeah.
I hate to say, but thanks to
Yeah.
the fact I have a good job,
Right.
and I do draw that Social Security makes a huge difference. And to
Right.
take one of,
Yeah.
it's, not too good.
Yeah.
But it says gradually increasing the retirement age for younger workers. The only difference with that, I guess they could draw disability, but what if we became ill,
Yeah, I guess maybe that's two separate things, right?
Right.
I
The
guess,
other
yeah.
thing they have is reducing benefit. Okay, and this is really coming to light, because this is reducing benefits for higher income retirees. So this kind of hits home with me, because I think it probably you too, because I would probably go into the classification of being a
Yeah.
higher income retiree.
Yeah, and that's not
And to
fair.
me,
Yeah.
I'm paying in on that
Right.
higher salary
Right.
I made.
Right.
So I don't think that's really,
Right.
I don't think I should have to work.
Right.
But I know that sounds very selfish, but it's
Well, it's kind of like the same argument we have sometimes about paying taxes.
right.
And there's so many, tax credits, if you will, or tax loopholes or whatever, that people, higher incomes usually take advantage of
right.
that. Where I'm saying I would still, I'm proponent of the flat tax rate. Everybody pays the same. I don't care if you make $1 billion, you pay this, and I don't care if you make $10,000, you pay this. It's all relative to your income. the same thing I think for this. It's
Right.
common sense.
Yeah. And then it says, but basically, what Congress could do is using a combination of of all those approaches.
Hmm.
It says historically, Congress has stepped in before when Social Security faced financing problems in 1983. Reforms extended to the program solvency, for decades.
Yeah.
So
Yeah. Yeah.
So, do you have any other topics you want to talk about on the Social Security?
No, I think it's important for everybody to do their own analysis,
Right.
their
And
own
what?
personal
Right.
analysis. When do you want to take it? When should you take it? When are you retiring? When are you not retiring? Everybody's situation is unique, and everybody needs to
See what's the
do
best.
their own
What's
research, get their advice, and things like that. I'm happy with the decision that I made. Um, you know. Um, so, I do think that it's such a hot topic that, it's not going away or nothing's going to happen. But boy, I mean, I don't know why they have so much trouble with it, over the decades.
One of the things that I learned is the fact that when my kids were young and I really didn't become successful or make a nice start till I was in my probably middle to late 40s.
Yeah.
And so I know when they figure your Social Security, they take out how many quarters or something you have to work, and that's what they base it on. Your top, it's like let's just use an example. Let's say your top 23 quarters or years or whatever.
Okay.
I don't know how that works.
Yeah.
So what happened to me, which has really been kind of a blessing, is the fact that my salary versus almost overnight basically doubled at one point. So when they go in and they figure your high earning years versus those low, every year they go back and they reanalyze your thing, and what happens is one of those low, but like if I made 30,000 way back then, and now if you make and now this quarter you're going to make over 100,000. Well, what happens is because you've worked in your quarter, well, that low quarter that was counted in drops off.
Oh, okay.
And then it brings back and they recalculate based on
your earnings
that year where you were from the beginning. And so it's a kind of a nice little
boost.
Yeah. And it helps because of the cost of living that you get is just doesn't keep up. But that's going to come to an end. I think I'm almost there now that it's not gonna change much because a lot of those lower years are gone.
Yeah.
But the next thing that really affects a lot of people and is a major concern right now is the cost of Medicare and healthcare costs. That's really tough. And a prime example is when because now you're not on Medicare, right? You still use.
No.
Let me tell you what happened to a friend of mine. He married somebody who's quite a bit younger than he is, and of course he qualifies for Medicare, and he just gets Plan A, but he has to stay on the company insurance because of his wife and she's very ill, and she's a lot young. She's probably 10 years younger than he is, maybe more. And recently he got very ill. He had a little bit of bout with cancer and had to have some problems, and then she had some problems, and he was saying that his last bill to take care of, to do the biopsy and everything, was $1 million.
What?
Yes, for a biopsy and the stuff with this thing. Now, unfortunately, because you're not taking total advantage of Medicare, the cost of that has affected basically the company's insurance policy. When you have huge claims. But we're going to get into that, and that kind of goes with the problem that we'll talk about, not this week, but we're going to talk later on about some of the issues when you're working at our age, and some of the the accommodations sometimes that need to be made.
Mm-hmm.
And one of those is what companies are going to, they have no choice.
Mm-hmm.
It's, they don't do it,
Yeah.
legally they're bound. But those are things, even when they're hiring and you're looking for even your little,
Yeah.
they have to, they take that because that's a big part of their
Oh
plan
yeah, absolutely.
and
And I
their profits.
right. And I will tell you that that is one area, I jokingly said that I forget how old I am, so I put off doing anything about Social Security for a long time or years until we
Right.
talked about it. Same thing with Medicare because I know, but now I need to start thinking about it because now I'm on this 3-year plan to stop working. Right now, I'm 100% covered at work. I've signed up for Medicare, but I don't use it just because you have to
Right.
sign up,
You have
right?
to sign up.
Right.
Right.
So, but I got to think about that. I've got to think about when I'm not working, and then then you get other plans like a
And it is,
B or
and it's very, very,
expensive, right?
it's not, well, that depends on the plan you go with, but it's very confusing.
Yeah, that's what I'm
It's the
saying.
most confusing thing. In fact, finally, I hate to say this, I had to just throw my arms, and a lady I knew that had retired, she was using, I think, Aetna,
Yeah.
and she was fine, happy with it.
Okay.
And I just said,
You
I
just
guess
checked
gave
it.
up, and I said, well, that one works for me. He's
Yeah.
like, you're happy, you go for it, and
Yeah.
I'm gonna go,
Yeah.
and I'm gonna go for it.
But they do make things so confusing. I mean, even just when I was trying to sign up and I was trying to understand, make sure I was doing it correctly and I wasn't going to affect anything in my future
Right.
doing this or not doing it. And, it's confusing.
Yeah, and it says that the current concerns, of course, the higher Medicare Part B premiums. You automatically, I guess, get Part A, but Part B is where you have to pay for your,
That's where you get supplemental
yes,
insurance, right?
your advantage,
Yeah.
and the rising cost of out of pocket medical costs,
Yeah.
and that's very true because like in the part I'm healthy. I've
Yeah.
been so blessed,
Yes.
but if you only have Part B, and which I have, and I'm on the like I said, I've got A and B,
Yeah.
and I'm on an Advantage plan. So when I have to look at this, I have to think, okay, if I go into the hospital, even on my plan, it pays for like 3 days or a week or something, and then all that hospital bill is going to come. The majority of it is going to come back on me.
God forbid you get
Something
a
happens.
disease. I mean,
Yeah,
get
yeah,
cancer or
yeah.
something. Then so what you're saying really is the supplemental insurance that you
It's great if you're
purchase
healthy.
yeah, it's not going to do anything if you
It's
have
it yeah
a
because
heart attack or
I don't have the plan that
what
and
is the plan? Is there one that covers more than that?
they're now the way I understand, I could be wrong, but it used to be my sister and them were the last year when they got on Medicare was the last year that they had it, and they had a plan that you pay quite a bit more for,
Mm.
but it would cover everything, and they go into the
Okay.
hospital and everything's paid and stuff, but they
Oh,
did away with that. So you
really?
have to now you have to pay additional insurance or premiums to get other coverage for other things. So, and then like on mine, the other thing Medicare does Part B is you got the raising cost of your out of pocket medical costs because
Mhm.
you're going to have to figure your copays sometimes go up. It's not that much, but depending on what you're having done tests, some tests
Mhm.
aren't done. Sometimes you have to get a referral. I think I paid $12 extra a month, so I don't have to get a referral somewhere. But to get this stuff again, you constantly have to pay. And the other thing is it's difficult finding primary care physicians and specialists.
Wow.
That's a biggie because that's just kind of like my doctor that I
Right.
used for
Right.
13 years,
Right.
who suddenly decided he was no longer going to even, not only was he not going to accept Medicare,
Yep.
he was not going to accept any insurance.
Wow.
He went strictly
Because
telehealth.
you can't blame them for
Oh,
what they have to go through with that. And plus, I know just from my niece being a dentist,
right.
she would be like, I'd rather have somebody come in and not deal with insurance. I
Right.
mean, that doesn't have insurance
Right.
and deal with the insurance. It costs me more
Right.
for that. So, wow, that's crazy. And Connie, I think looking ahead to the future, and I know we talk about retirement and our life going forward, I think nothing scares me more than lack of insurance and health issues.
Exactly.
which brings us all the way back around to what can you be doing right now to try to stay as healthy
as
as you can
some
and
of those
preventative.
things you have no self control
No,
over,
you're right. You're absolutely
and they
right.
just
But if there is something you can do,
right,
I
you
mean,
you should
you should.
you should do it,
But you're
and
right.
you're limited because you have no there's no dental. I think they let you have a cleaning a year, but we all know expensive dental if you have any
Right.
kind of procedure.
Plus,
Vision
your teeth
or
eventually kind of wear down, and
exactly.
you need something.
Vision. Now I know with my vision, I get this will it's changing. So last year and last one, I guess probably the last few years I've had my coverage, I would get an allowance that would I could get a year's supply of contact lenses,
Okay,
and for the same amount of money this year, they only give you 6 months.
that's just in a year's time.
Yeah,
You went
that it's
to half.
changed, and there's never really any hearing coverage for if you're hard of
Mm,
hearing and you need that kind of. Which you got to remember, if you're on a fixed income
yeah,
and hearing is important,
yeah.
what do you do?
It seems like I have heard about that. Like hearing aids aren't covered or anything
No,
like that.
that
That doesn't
isn't.
even make sense that they're
Mm-mm.
not covering the issues that are predominant when you're a senior citizen.
And but the sit on the positive side, Medicare has begun implementing and negotiated lower prices for some of the high cost prescription drugs. Again, I'm going to go back to the GLP-1,
Right,
which just started out being like $1,000 a month, and it was very limited. You couldn't get it. No,
right.
your in fact, I when I first tried to start on it, I got it, and it was I paid like $80, and then the month when it became so popular,
Hmm.
I was declined it. They
Really?
wouldn't let me they wouldn't let me get it. So the thing is now they've got the new bridge program because they're finding that it does help and it saves lives and it helps people
Yeah,
be healthy and people
yeah.
with diabetes. So the negotiation again on the higher cost of prescriptions, like I said, we talked last time. My dad had brittle bones,
Hmm.
and his prescription that he had to take was like $900. So some of these prescription drugs are so expensive. When I started needing to take fish oil, there was a fish oil out there that the insurance company didn't cover that was like around $200 or $300 a month. The
Wow.
other thing you can do that's really been helpful because I do take a high end fish
Hmm.
oil is you can look at the Good RX and some of those,
Mm.
but some of those really drugs and things that are out there that are so
Life changing,
they're
but you
it's
can't.
life
Yeah,
saving.
yeah. Life's changing, life saving. Yeah.
They're not
Wow.
covered.
That just doesn't make sense. This is such a long, serious topic that we probably should break this up to if you want to
Yeah.
into two parts. Okay, let's do that.